The British Department for International Development is calling on medical practitioners in Nigeria to carry out proper diagnosis before treating patients for malaria. A country director of the Support Nigeria Malaria Program, Dr. Folake Olayinka, told a press conference in Abuja that Nigerians must imbibe the culture of getting the proper diagnosis at all times, as that's the way to go in medical practice. Dr. Olayinka explained that the preemptive treatments most times allow the malaria parasite to develop a high resistance to subsequent treatments.
A presumptive consumption of anti-malarials may result in substantial unnecessary use of this class of drugs, and the risk of developing resistance is very real if it is not discouraged. However, we believe access and demand for diagnosis, that is testing, for all suspected cases of malaria before treatment will foster proper malaria case management, which in turn will reduce the huge resources that are wasted on presumptive treatment by households in Nigeria. Findings from subsector analysis conducted earlier in the year show that a perceived high cost of diagnosis, which in effect makes presumptive treatments and lack of awareness of the government policy on malaria treatments before treating, are responsible for the poor testing culture amongst Nigerians. SUMAP's vision is to build private and public capacity to transition from a supply-driven market to a demand-driven market where consumers ask and demand for the right tests and the right treatments for malaria.